So by participating in the support group calls, you are acknowledging you understand there are no mental health providers or attorneys on this call, and that nothing said here is any way to be interpreted as mental health counseling or legal advice. So now I will introduce our guest speaker, who basically needs no introduction. That is Linda Gottlieb. I put this into the announcement. She's the founder of Turning Points for Families, a reunification program for reuniting children with their rejected parent. She's a former faculty member of the Minuchin Center for the Family. She has 50 plus years working with 5,000 plus children and their families in multiple professional, clinical roles and settings. She's a member of American Association of Marriage and Family Therapists, American Professional Society on the Abuse of Children, Parental Alienation Study Group, and Association of Family and Conciliatory Courts. She's also a an advisory board member of ISNAF. Linda is a qualified expert in parental alienation, estrangement, family dynamics, family therapy, child abuse, child sexual abuse, child psychological abuse, domestic violence, child custody, forensic evaluations, and family systems evaluations. She is the author of the Parental Alienation Syndrome, and the list goes on. So with that, Linda, the floor is yours.
Good evening, everyone, and thank you for inviting me to this presentation. I do want to say that this PowerPoint presentation will be posted on Cindy's website, the ISNAF website, so you don't have to take a lot of notes. You will be able to get everything that I have talked about, all the PowerPoints. I realize this audience is lawyers, alienated parents, and therapists. So I've tried to make this presentation meaningful to all three groups so that they all can take something away from the presentation and use it in their situation, unfortunate situation. So let me begin with that, and so these are the four topics that I hope to cover in this presentation. Summary of the science underpinning the phenomenon of alienation, and bringing that science into the courtroom so you don't have to keep dealing with the junk science arguments and the naysayers. That's very, very important to all three of you in prosecuting your case, litigating your case, dealing with the therapist, and the entire situation. It's also important what to look for in a reunification therapist, and also going over some of the mistakes that you wind up in this terrible double-bind situation with traditional reunification therapists. I could not do this presentation without dedicating it to my dear friend and colleague, Stephen G. Miller. All the science in this presentation I learned from him. And so many of you out there knows what a wonderful person he was, so dedicated that he would take anyone's call, dedicate lots of time to deal with your personal situation, and just a tremendous, tremendous loss that I can't even begin to calculate. So in this presentation, I just wanted to share some of my experiences with him. This was taken in 2014 at a Connecticut presentation before the Connecticut Legislature Task Force on Child Custody. This is a couple, a very famous Connecticut case of the three triplets, and obviously they have no problem with sharing their story. This was taken in 2016 when Steve and I did a presentation under the auspices of the Delaware Psychological Association, where we actually met with three families who had come through the Turning Points intervention very successfully. And while we were there, they asked to meet Steve and me, and I obviously edited out those family members, which is why you have half a picture. This was taken in 2017, I believe, at the PASG International Conference in, I don't know if it was Washington or Philadelphia. I don't remember where. This was taken in Stockholm for the 2018 PASG conference. And we were in front of a famous museum. And Steve, I'm sorry, I forgot the name. If you're looking down at me, please don't hold that against me. But he took a number of pictures. He had to cover all the bases. So I do want to share, this was this was taken in Florida in 2019 with my colleague, Shazia Sparkman, an alienation lawyer in Florida, Tampa, Florida. Steve and I were there on a case. And I just thought that if I'm dedicating this, I have to tell one of my Steve Miller stories. So we were on a case together a number of years ago. Steve was brought in to rebut the person who rebutted my evaluation and critique. And that nitwit person, who was, I won't mention his name, he was actually on the faculty of a university, claimed that he taught clinical reasoning and decision making, but he incorrectly defined the word empirical. I thought I learned that in Physics 101, but obviously this expert college professor alleged couldn't do it. So he was sitting at the desk of opposing counsel, which the experts were allowed to do in this case. And so he was throwing questions for Steve's cross. And of course, Steve disarmed him completely. So the very last question the lawyer chose, he was in a hole, he thought he'd stop digging. This other expert said, ask Dr. Miller to define the word validity. So in this time-limited case, everybody had very limited time to present their case. Dr. Miller said, that's a very interesting question. I'm so glad you asked it. His sandwich technique, and of course, that's always going to throw opposing counsel off with that introduction. So he said, well, there happens
Morgan, I walked down the stairs. You tiptoed pulled the leg.
There happens to be a number of forms of validity, and maybe you could tell me which one you would want me to define, or would you want me to define all of them? So he said, well, there's internal validity, ecological validity, external validity, construct validity, content validity, criterion validity, concurrent validity, and so on. And so Dr. Miller said, I could define all of them for you. And opposing counsel said, I actually have no more questions of you, Dr. Miller. And he just decided that he wasn't going to waste his time anymore with this expert. So, Steve, we all miss you. We all think about you every day, and you are with everyone you trained because we are carrying on. Okay, so what is alienation? Just to briefly state it, it's the rejection of a parent, sometimes referred to as the target parent, by a child who has been influenced or programmed by the other parent or another parental figure, often referred to as the favored parent. It's absent a bona fide protective reason. It may be intentional or unintentional. The rejected parent's behaviors do not rise to the level of clinical significance for abuse or neglect as determined by a scientific method, and it's very important that we understand that method because so many parents are indicated by the word of the child when they did not abide by the scientific method to make clinical findings. And I'm going to discuss that briefly. And the rejected parents' behaviors are utterly out of proportion to the exceedingly anti-instinctual clinical condition of child rejection of a parent. I think this is things that you can find. Typical parenting mistakes will not qualify as abuse. So now the competing hypothesis to explain this clinical condition is estrangement. And estrangement must occur in the absence of an alienating influence. It is a justifiable rejection. In other words, there is valid abuse and neglect by a scientific method. Estrangement cases are very, very rare. And we will be discussing that why as I go on to discussing the scientific method for making clinical findings. In a hybrid case, which is also rare, it's a combination of alienation and estrangement. The alienated or the rejected parent has done something to qualify for abuse and neglect with scientific method, but the rejected parent the alienating parent blows it out of proportion, makes it worse than it is. This is very, very important to remember. I get so many cases where there was prior abuse and they bring that up as saying that this is the reason the child has chosen on their own to reject the parent. Very often the abuse has been remediated and the parent has been forgiven. And there are many years of a close relationship after that. And then for whatever reason that the alienating parent wants to drive the other parent from the child's life, they claim that that abuse caused it. That is not possible. If the child forgave a parent for remediated behaviors and they had a wonderful relationship for a number of years, that in my mind would not qualify as a true estrangement case. And that must be scientifically evaluated. So a hybrid case should never be automatically assumed, or a case should never automatically be assumed to be a hybrid case. This is directly from Steve, just because both parents played a role. Two factors must be assessed in a hybrid case, which I've seen it never, ever done in these frequent assessments for a hybrid case, that it doesn't exist. First of all, there must be a causal connection between the rejection and the rejected parent's behaviors. Very often, the rejected parent's behaviors as a reaction to the alienation are identified as the cause of the alienation. That is not possible. For something to be the cause of something else, it must precede the dependent effect. So that parent's behaviors must be assessed to see, was it prior to the onset of the rejection? The next reason that hybrid cases are often made incorrectly is because of the violation of the clinical axiom to consider severity. Very, very important to evaluate the extreme behaviors of the alienating parent as compared to what the rejected parent has done. Very often, what the child says caused them to reject that parent, the alienator does the exact same thing, and the child doesn't reject that parent. Or that parent had those typical mistakes prior to the rejection, and the child didn't reject that parent. We really need to assess the alienating behaviors for something that's really, really important. The fact that the alienator is modeling for the child antisocial behaviors. This to me is almost worse than the alienation, because the parent is violating court orders and involving the child by not sending the child for the parenting time. They are making knowingly false child abuse and DV allegations and asking the child to lie and confirm them. They are reporting deceptively and untruthfully, and they totally lack their child's need to have their other parent meaningfully in their life, and for the other parent to be meaningfully involved in the child's life. These are very serious behaviors. They're rarely evaluated by the typical forensic evaluator or traditional reunification therapist, and it far exceeds anything that the alienated parent has done. The truth does not lie in the middle in these cases, and you have every right to ask the evaluator or the therapist to evaluate for severity. So this is more of what I said and a greater explanation. I actually was joking with Steve one day, and I said to him, you know, Steve, if it's a hybrid case, it still involves alienation. So let's remove half the child who's alienated, and perhaps the estranged child will follow. Because really, if it's a hybrid case, alienation's involved, and that's child abuse. And this is just some of the science in the clinical literature, and I'm just going to flip through it. You can get it from the website, but you should be able to argue in court that this is not junk science. This is in the Kaplan and Sadek's comprehensive textbook of psychiatry. It's something like 3,000 pages. In there, Dr. Burnett wrote a write-up using the words parental alienation, the same wording that's in the DSM-5 on pages 715 through 719, that it qualifies as psychological child abuse. This is the basic textbook that all psychiatry students study and is relied upon in their careers. So anyone who says that the psychiatric community hasn't accepted alienation is lying, they're deceptive, they're ignorant, or all of the above. This is Dr. Burnett's book. I'm sure he'll talk about it in his presentation, where he cites the hundreds of professional articles and chapters that accept alienation. On page 205, Dr. Baker, we've all heard of her, she wrote up about all the research studies that support the manifestations of an alienated child that Gardner identified, and the 17 research-validated alienating behaviors that she and Fine did a research study on. And this is the reference in the DSM-5. And again, you can find that on when this is published. This is an article from 2016, I believe, that Dr. Burnett wrote with two contributors to that section of the DSM, and they specifically identify parental alienation as one form of family dysfunction that qualifies as child affected by parental relationship distress, which is on page 716 of the DSM. This is very important to argue in court. This is an article that Dr. Burnett published in a peer-reviewed journal of the science behind his 5-factor model. This is by one of our colleagues, Ashish Joshi, who wrote Litigating Parental Alienation, and he cites all the science. This was published by the American Bar Association. This is an article written by Dimos Larandos, a lawyer and a psychologist, co-author of the book with Dr. Burnett, Science and Law. And he talks about more than 1,100 appellate court cases in this country that found the testimony of the trial court on PA to be material operative and relevant. This should all be used in your cases to argue any dispute by a Daubert challenge or anyone who claims it's junk science. And this is by another colleague, Jennifer Harmon, Richard Warshak, again, Demos Lorandos. And they talk about all the research that confirms the phenomenon of parental alienation in the last several years. Another important article to use in court. I'm not going to go into details here. It's on my website. I've written about it extensively. Parental alienation not only has been in litigation for more than 200 years, the concept of alienation, known as triangulation, was the basis of the founding of the family therapy movement in the 1950s. So we go way back with that history. And I explained that there. A rose by any other name is still a rose, whether you call it triangulation, restrictive gatekeeping, selfish gatekeeping, it's all the same concept. And this is the founder of PAS, Richard Gardner, who first identified the 8 manifestations of an alienated child that are accepted in the scientific community and have been since researched and known to have a known error rate of less than 1%. I wish all my medical tests had a known error rate of less than 1%. My mammogram has a known error rate of 10%. This is highly important information to argue for your case and with any therapist who denies it. So these are the 8 manifestations and 3 additional ones. They'll be on the website. I'm going to give Cindy something I've written up to give greater definitions of these with examples. This is Dr. Miller again. This is a complex medical clinical situation. He cites that severe alienators likely have more than one or more personality disorder, narcissistic, borderline, antisocial, and paranoid. This needs to be considered when you consider the clinical axiom to consider severity. I want to make this point. It's been argued that only mothers do this, and that's why a lot of women's group oppose it. That's not true. Gardner never said that only mothers do this. Our research shows that fathers will engage in alienation in equal percentages to mothers when given the opportunity. So this is an equal opportunity employer, unfortunately. I want to go over this very briefly and take the time for this because we hear this all the time. It is a straw man argument to equate parental alienation syndrome with parental alienation. And we didn't just change the language to avoid the controversy. They are 2 different things. They have similarities, but they're not the same thing. A syndrome can only apply to an individual. So if you're talking about parental alienation, those 8 manifestations and the 3 others we identified apply only to the child. It's a very limited way of assessing this problem by focusing on the child. It leaves out the parents, particularly the alienator, but also the effect on the alienated parent. That's why we use the word parental alienation. It is a phenomenon that includes all the family relationships, which is why it's in the DSM under relationship problems that can become the focus of clinical attention. However, saying that parental alienation syndrome does not qualify, or the Gardner's manifestations don't qualify as a syndrome is a straw man argument. And it's based on what I consider to be, well, I'll leave it to the lawyers to decide if this was academic fraud or not. So this is the definition of a syndrome. A group on page 830 in the DSM, a grouping of signs and symptoms based on their frequent co-occurrence that may, M-A-Y, suggest a common underlying pathogenesis, course, familiar pattern, or treatment selection. This is what Kelly and Johnston wrote in 2001, upon which all the arguments that it's not a syndrome relies upon. They write, because there is no commonly recognized, empirically verified, and they finish the sentence. They turned a may into a must. And that to me is really, well, it's unfortunate because what the result to children, the result is actually criminal. So it really is a syndrome, the 8 manifestations. And in fact, in the very article that they said it can't be a syndrome, they go on to accept all 8 of Gardner's manifestations to identify an alienated child. Also notice they didn't say the alienated child doesn't exist. It's a reformulation of parental alienation syndrome. So that's also very important. In court, you need to know this. Your lawyers won't know this. Most of your therapists won't know it. And most forensic evaluators won't know it. So, like I say, these are the 7 manifestations. I don't know if this might be duplicate. Okay. So what do you want to look for in a forensic evaluator or in a reunification therapist? Because all of us don't have those skills. There are so many choices. However, there is a big difference between someone who knows family dynamics and all the other mental health disciplines. I'm going to make a medical analogy here. We all understand in medicine that you have your expert and your specialist. You have your primary care physician, who's your expert, and then you have your cardiologist, your urologist, your orthopedist, neurologist, and so on. Well, family therapy is a specialty discipline within the field of mental health. It has a very distinct knowledge base. That's why all 50 states licensed it, because it has a very distinct knowledge base from all the other mental health disciplines. And alienation then is a subspecialty within the field of family therapy. It would be analogous to the cardiologist who just specializes in the aorta. We need to understand these levels of specialization. Normal mental health clinicians who have not studied the foundations of family therapy and then specialized in alienation are not specialists in alienation. What you need to become a specialist in alienation is a knowledge of family dynamics, a knowledge of child development, pattern recognition for alienation, which comes with experience. And you also have to have a knowledge of all the counterintuitive issues that Steve has often talked about, which is outside of this presentation, but I'd be very happy to present on it. You obviously need Gardner's 8 manifestations. You have to know what they are. I can't tell you how many evaluations I've read. Alienation doesn't exist. No, it's not alienation. Well, you can't rule out a clinical condition without knowing its manifestations, its signs and symptoms. And they often don't even know even a single manifestation. Well, that is not, imagine someone going into the emergency room with symptoms of a heart attack and says to the doctor, I just have indigestion. And the doctor doesn't do any tests and says, okay, I take your word for it. Here's a handful of Prilosec. That is not how we do it in medicine. It should not be how we do it in mental health. And you also need to know what the research validated alienating strategies are if you're going to say a parent hasn't engaged in them and they don't do it. You have a right to look for it in the evaluation. Did they even mention the manifestations and the alienating behaviors when they ruled out for alienation? And finally, you need competence in applying the scientific method to the case evidence. This is what the courts are all looking for. And so for the therapists in the audience, I'm going to get into some of the common cognitive and clinical errors that are violated for the lawyers and for the alienated parents. You just need to be aware that they exist and look for them or hire an expert who can look for them. So these are some of the skills that you need. And in the interest of time, I'm going to skip over them. You can get them when this is on Cindy's website. This is what you need to look for when you find a specialist. And for the lawyers, you know, I've spoken to many lawyers. Marital lawyers have a good foundation with tax lawyers, international lawyers, but they said they would be a fish out of water if they had to prosecute one of those cases, and vice versa. Well, the same thing applies to therapists. The DSM-5 is almost 1,000 pages long. No one person can know every single one of those clinical conditions and be an expert in them. You should know that if they're practicing outside their area of expertise, they're ruling out alienation when they don't know what they're doing. This is a serious board violation. So what are some of the common errors that traditional therapists and forensic evaluators make? Okay, so these are just, there are probably about 30 of them, and you will find them in Steve's chapter in the book, edited by Amy Baker and Richard Sauber, working with alienated children and their families, a clinical guidebook. Chapter 2, Steve's chapter, clinical reasoning and decision-making. This all came from his chapter. This is a fraction of what's in there, a fraction of what the typical forensic evaluator and therapists commit when they rule out for alienation. Failure to use proper reasoning, the straw man logical fallacy that children must be interviewed to make a forensic evaluation, a base rate neglect. I'll explain a little bit about what they are. I don't expect you to know it, but you have a right to ask any evaluator, are they familiar with it? All right, so this is the clinical axiom to use proper reasoning. It has to be a combination of intuitive reasoning and analytical reasoning. Intuitive reasoning means I have a gut reaction that the people in front of me are reporting accurately and reliably. So listening to the voice of the child when they're reporting false abuse allegations and not verifying the abuse with medical records or independent neutral sources, which is often what they do, that is relying just on intuitive reasoning. It's a violation of a clinical axiom to use proper reasoning. It must be verified with neutral sources like pediatric records. Why were the reports made 3 years later, suddenly when there's a divorce situation going on? That doesn't make sense. You have to use proper reasoning. And the child had a great relationship for years after the alleged abuse occurred. There's an article and a research study, Ignoring the Evidence, Why Do Psychologists Reject Science? I don't want to just focused on psychologists. I think the entire mental health profession does this. They just rely on intuitive reasoning that someone is telling the truth. Their instincts that someone's telling the truth. I'll get to the research about why that's so bad. So this comes from the actual study that Sharon Bagley wrote that article about. She was the science editor of Newsweek. And I can't see this exact quote here, Many clinicians give more weight to their personal experience than they do science. As a result, patients have no assurance that their treatment will be informed by science. The disconnect between what clinicians do and what science has discovered is an unconscionable embarrassment. And elsewhere in this article, another contributor has stated that that the mental health profession is operating in the pre-scientific era, like medicine had done. These are some of the reasons why you can't rely on just intuitive reasoning, that lying and deception are natural instincts. We all know this. We have to teach our children not to lie. They're not bad, but it is part of our survival toolkit from hundreds, maybe even thousands of years ago. So, and this is some of the research about that, which you should know and talk to your therapist or forensic evaluator. Why do you believe my child? Making these allegations 5 years later wasn't an issue then. Are you familiar with the fact that lying is instinctive, and that's why they appear so credible? So this is just some of the more research. You'll get it from the website. Next, we are very poor lie detectors. The research by these people, and they did it on all the studies combined of thousands and thousands of people, that we can only distinguish lying from telling the truth 54% of the time. It's almost like flipping a coin, no better than that. And I think that applied to CIA investigators, certainly not your average therapist or forensic evaluator. So again, listening to the voice of the child when we only have 50% accuracy is terrible. Okay, so why listen to the don't they look so terribly credible? They can't sit on juries, but they can make decisions about a relationship with the parent and whether child abuse has occurred. So, of course, in an alienation case, relying on your instincts that someone is telling the truth is even more serious, because the research shows that the brainwashing in alienation is like the brainwashing in a cult. This is more research. Children are very suggestible. It's amazing how suggestible not just children are, but adults. And I'll tell you about one study that really was an eye-opener for me. This is some of the research about that you may want to rely on. And this is research by Bruck and CC, the suggestibility of children. When children are repeatedly and suggestively interviewed about false events, assent rises with each interview, just by asking the question about the situation, even that could lead to a sexual interpretation by the interviewer. This is very important research. This book was published by the American Bar Association. They followed 1,000 children of high parental conflict. They found that 86% of those 1,000 children had been subjected to some degree of weekly brainwashing. 86%. This is an article written by a lawyer. For the lawyers in the audience, absolutely, this should be given to the lawyer for the child. It was published in Family Court Review, where he specifically talks about the alienated child. Their lawyers should substitute judgment, because they're really not representing their client's wishes. They're representing the wishes of the alienating parent, and that this is placing the children at risk, which is another reason the lawyer does not have to represent the child's wishes. Very important information. Richard Warshak, another colleague, he writes about the pitfalls of listening to the children and talking about influence that needs to be evaluated. Okay, this is a very complicated scientific principle. I can't tell you how many hours I was saying to Steve, I'm never going to get this, Steve. He'd say, yes, you will. All clinical assessments must consider what's known as the prior or the base rate. It combines two things: everything we know about that clinical situation and what is the prevalence in the general relevant population. It takes a lot to understand this, but it's so important in determining whether it's alienation, estrangement, or a hybrid case that explains a child's rejection of a parent. Just to give an example, the base rate or prior of a woman in the United States of having developing breast cancer is 1 in 8 or 12.5%. That's the prior. That's the starting place. Now, 12.5% may not be a huge prior if it's any other woman but me. If it's my prior, I would like it to be 1%, but it's still relatively low. And what that means is you do need a lot of evidence in the opposite direction to overcome a prior like that. For example, like the BRCA gene, or first a mother or sister having contracted cancer. That raises any woman's prior. Okay, so what do we know about the prior for a child rejecting a parent? It is anti-instinctual. This was my work with 3,000 abused and neglected foster children. The most frequently asked questions: when is my next visit and when can I go home? This was a research study done by our colleagues, Amy Baker, Steve Miller, William Burnett. They did a study of an estimated 17,500 moderately to severely physically abused children. They not only didn't reject their parents, they sought attachment behaviors to their parents. And this is what some of their findings were. You can get it from the website or get the article. I'll be happy to send it out. Cindy probably already has it from either Bill or previously from Steve or Amy. This is Bonded to the Abuser. This was also a book by Amy Baker, found the same thing when she dealt with these children. So my question is this: if children who are abused seriously don't reject a parent, why would a child reject a parent when the parents are going through a divorce and they had a prior positive relationship and there was no abuse and neglect? What can account for that? Only, to me, only a brainwashing. We are starting with a very high prior for alienation to explain a particular child's rejection of a parent. And then when you throw in that there is nothing in that parent's behavior that was abusive, had a clinical significance for abuse and neglect, why on earth do we jump to the conclusion that it's a hybrid or an estrangement case? I think because of our knowledge about the prior for this situation, that the burden should be to prove that alienation is not the cause of a child's rejection, rather than it is the cause. But that's science that's overlooked, and that's why it's very important for all people in this audience to look at that when a case is being evaluated or treated. This, to me, is also very important to understand. I have found that in 80% of my severe cases, a false allegation of abuse or neglect or domestic violence occurs in almost all those cases. And this is research done by George C. Davis, a child psychiatrist of the Children's Law Institute. Hardly someone that's going to be out there favoring the parent or an alienated parent. And he put together a lot of research. He evaluated tons of research on childhood memory and what happens in cases of sex abuse. The prior he found for sex abuse occurring in a contested custody case is less than 2%. Less than 2%. False allegations in these cases could be as high as 35%. Those priors are rarely evaluated by Child Protective Services or a forensic evaluator. They cannot make a clinical assessment for the validity of a sex abuse allegation without considering a 2% prior. And as Steve would say, a 2% prior, it's actually less than 2%, is so low that what kind of massive overwhelming evidence would you need in the opposite direction to overcome that prior? I don't think anything less than a videotape of the actual incident would overcome such a prior. And yet we give voice to the child. It's backed up by the alienating parent, and therefore it must have happened. You cannot make a clinical finding on that basis alone, intuitive reasoning. And here, Dr. Davis just talks about, when do these false allegations arrive? Conflicted caretakers, adversarial leading proceeding, positive and negative consequences that he calls about coaching. So I'm just you have this in the PowerPoints. Another situation that is failure by therapists and evaluators is to develop a differential diagnosis. What does that mean? It means that you need to know the difference between a heart attack or indigestion causing the symptoms. Is it alienation? Is it estrangement? Is it a hybrid case? Yet most therapists go in there and they're treating the severed relationship without asking why. Steve would say it is not that a parent has been rejected. The question is, why has that parent been rejected? And this is key because the explanation, the diagnosis of alienation, estrangement, or a hybrid, all three treatment interventions are diametrically opposed. You give Prilosec to a heart patient, and look what's going to happen when he gets behind the wheel of a car. The same thing with alienation. If it's a case of alienation and you're treating it as estrangement because you didn't do a differential diagnosis, it's going to be catastrophic. You have a right to ask the therapist, what is the cause? What is the diagnosis here? Skip over that. Failure to develop treatment priorities. Okay, the highest priority is to protect the child. This is from Steve, not to restore the relationship with the alienated parent. That's secondary. And by the way, the more dysfunctional relationship is between the child and the alienating parent, which we could save for future presentations because they're pathologically enmeshed. That's the more dysfunctional situation. I liked this. It compares parental alienation to child grooming for sex abuse. Every one of the qualities applies to both. This is Clower and Rivlin, the same book I referred to before. Sending a child for what they are calling reconciliation therapy for an hour a week is never going to work if the child is returned to the programmer for the other 167 hours during that week. Our research continues to confirm, regarding 1,000 children, that even under court order, traditional therapies are of little, if any, benefit in regard to treating this form of child abuse. That's what it is. And this is some of the other comments by other professionals that traditional reunification therapy is not going to work. Even in moderate cases, many moderate cases. So here you have more research in this book, which you can be armed with. I'm not going to go into why it is psychological maltreatment too much, but it qualifies as ACE experiences. And this is some of the research about that. You can get it from the PowerPoints. Okay, This is also very, very important for everybody to understand. How many evaluations you've picked up saying there's no alienation and the rejected parent is anxious and that's caused the rejection, and they make their findings and they don't tell you to what degree of clinical certainty those findings are made. Whatever they say, they don't tell you to what degree. Well, is it 100% clinical certainty that you're abusive, for example? No clinical test is ever 100%, except maybe a biopsy, but that's very rare. Notice in their evaluations that they rarely say what degree of clinical certainty they've made their findings. Whatever it is in the case, it's against you and in favor of the alienator. Sometimes they will say the standard to a reasonable degree of psychological or clinical certainty. Well, you need to know that that reasonable degree, it's the preponderance of the evidence, more likely than not, is a shade over 50%. That's all it is. That means it could be a shade under 50% that they're wrong. So they're driving you from your child's life or telling you you suddenly need supervised visits and rarely need have visits because they're only 50-50 right, because basically that's what it is. And you have every right to ask, what degree of clinical certainty are you making these findings about me? That I committed child abuse or that I committed domestic violence or whatever else. And then they have to defend it. How does the evidence support their clinical certainty? They can't do it because they haven't abided by the scientific method to make findings. These are all ways, and I'm giving you information, by the way. I'm not telling you how to present it to your therapist. I'm not even telling you how to present it to your own lawyer. That is something else. That is something that Steve did very well. There are people out there that can do it. But I'm giving you information but how you present it will require coaching. So traditional therapy is contraindicated for severe alienation, meaning forbidden. It's like giving Prilosec to someone who's having a heart attack. So what are some of these mistakes? Mistakes were made, not by me. Okay, so these are some of the mistakes, typical mistakes that you find you are confronted with in therapy. You're asked to validate your child's delusional thinking about you, that you committed child abuse. Accept their feelings, and you're criticized when you don't. Yet nobody seems to make the evaluation whether the child's feelings are based in reality or are delusional. And that's a big difference. But they don't make that determination. They will often say, if the child believes that it's their reality, you must accept it. No. If a child comes into the therapist's office and says, I'm Superman or Superwoman, here's my cape, open your window on the 10th floor and let me jump out and prove it to you. Well, they wouldn't let the child do that. Why are they asking you to validate the child's opinions about you without verifying the merit of those opinions? I've had therapists tell me that even if they're false allegations of sex abuse, the alienated parent should validate it. Well, think about what that will do. They're a mandated reporter. Said, yes, I sexually abused you. Guess what happens now? I mean, they don't think this through, and they need to. So these are, I'm going to go through all the list. I won't read them out. I'll save some time. And what did I do here? Okay, I'm going to go through them one by one. So I just went through validating, and you should not have to be asked to apologize for anything you did not do. You're criticized for that, and you have to figure out with your lawyer how to handle that. it is very dangerous to focus on this asking you to apologize. It backfires. Then you have apologized for mistakes you have made, and it's too little, it's too late, it's not genuine, it's all of the above. These apologies just reinforce the child's already over-empowerment status. So I've talked about that. It's ammunition for the alienating parent. Aha, your other parent finally apologized. It took all this time. So you're disempowered and you're humiliated. So I like this. Someone wrote this because that's how I think therapists make alienated parents feel. A lot of them, and forensic evaluators. This is all the same. Science matters. There is absolutely no evidence at all for validating anyone's opinions and feelings and thinking it has therapeutic value. You need to ask that therapist, show me the research that shows that validating my child's feelings have therapeutic value. There is none. And they should be asked to produce that. And of course, if it's delusional, there's even less validity to doing that. But I've never seen a single study that said validating somebody's feelings is automatically therapeutic without doing an evaluation for the validity and reality. This also happens. The child is overempowered and you're disempowered. They're allowed to say, I don't want to talk about that. Oh, well, we can't make the child uncomfortable. Oh, no, little Johnny isn't comfortable. We won't let him talk about that. They're allowed to talk very disrespectfully and uncivilly. I never understood this. I was trained as a family therapist that the process has to be working well before the content is working. We, in the mental health field, should not be allowing children to express their anger and feelings uncivilly and disrespectfully. We are required to teach children how to express themselves in a socially appropriate manner. They will grow up and feel they can talk to their boss that way, or even worse, their partners that way. That is not wrong. That is not healthy. It's not appropriate. It's not therapeutic. And I don't know why therapists allow that to go on. And the child is disrespecting the therapist too. Anything that's happening in the therapist's office is a reflection on that therapist. It perpetuates the reversal of healthy family hierarchy to validate the child and put the parent at the bottom and talk in that overempowered tone of voice. So this form of therapy blames the alienated parent. They treat the alienated parent as if they're a child abuser. They fail to ask or show no interest in the alienating parent's perspective on the family dynamics. That's a violation of the clinical axiom to consider the total clinical picture. Who would go in to listen to one side of a debate and make a decision for that debate, or sitting on a jury and only hearing direct and not cross? And yet that's exactly what happens in therapy. They don't want to know your side of the story. So this is another problem that overempowers an already overempowered child. They're permitted not to show up for the therapy. Why would we upset little Johnny? They can dictate what the therapy's about. They could take a time out anytime they want. You can't. They can decide when the session is over. I can't tell you how many therapists have gone out to the car to try to get the children to come into their office. That is not the therapist's job. That is the parent's job. The parent is responsible for a child's behavior. And if the parent can't get the child to cooperate with a medical appointment, they are not competent. And if they're not competent, they can't be the residential parent. This is what I believe happens in that therapy. This is therapist-assisted elder abuse. Failure to identify appropriate criteria for progress and success. You are entitled to have a treatment plan with definite behavioral goals and anticipated completion dates. When was the last time you had that treatment plan? And you are allowed to participate in the development of those treatment goals. How many times has a therapist written up, well, they haven't written anything, but they report that you're not cooperating with their treatment? Well, imagine a medical provider saying, well, you need an operation, but I'm not telling you what it is. I'm not telling you how long it is. I'm not telling you what the risks are. I'm not telling you how much it will cost. And I'm not telling you if you'll recover. We are bound in mental health to abide by the same standards of clinical practice as medicine. The AMA has published on their website their ethical standards for physicians and all medical providers. It applies to mental health clinicians. They don't abide by it, but it's your patient bill of rights. You have it in a hospital when you go in. It should be in the therapist's office too. Making statements like, I'm feeling better or I'm feeling more comfortable, that is not acceptable progress. You are entitled to behavioral changes and improvement, including, if you haven't done anything that's abusive, including contact with your child outside of the therapist's office. Okay, I think I've discussed this. Feelings take time to change, but behavioral change does not. With the proper consequences, behaviors can be changed, and that must apply not only to the child, but to the alienating parent. Taking baby steps towards reconnection is also based on a faulty assumption that the child needs time to adjust, as if the alienated parent is too dangerous or can be tolerated in small doses. That sends the exact opposite message of what you want to send to the child. The child's contact and ability to behave towards you is not dependent on time. It is actually dependent on the alienating parent's genuine cooperation and support. And if they can't provide it, it's the wrong therapy. These are just more examples. I want to rush through it because so if I haven't made myself clear, this therapy is about behavioral change. If you look at your mental health card, more likely than not, it will say Aetna Behavioral Health, United Healthcare Behavioral Health. It does, and all the other plans say similar things. It does not say having a child's feelings adjust to the point where they'll stop abusing a parent. You will not find that on your mental health card. This is about mental health treatments, about behavioral changes. Who is accountable? That's another thing that the traditional therapists fail to do. Hold the alienating parent accountable. They're the ones with leverage over the child. They should not be excused from the therapy. Again, behavior is something that parents need to be in charge of. And if you haven't seen your child in 2 years, 3 years, whatever it is, even a few months, your child's behavior reflects on the alienating parent. The therapist should be holding that parent accountable for expecting the child to behave. If the child assaulted a teacher or disrespected a teacher, everyone would be on that parent to say, get your child to behave. Well, why should the other parent not have the same consideration? So this is just some more of the same. Abusive behavior starts at home. Failing to judge the alienating parent by their behavior is toothless. They need to be evaluated by their behavior, not by their vague words. I support a healthy relationship with the other parent. But they don't do anything to back it up. And they notice the word there is healthy. The implication is the relationship isn't healthy. So their plausible deniability is, well, the relationship isn't healthy. That's why I can't support it. Watch their words. The therapist fails to recognize a failed therapy. These go on for years. It makes no sense. The research shows that children will flip like a light switch when the alienating parent requires them and really conveys genuine support for the relationship with the other parent. It's a violation of the standards of clinical practice to provide a knowingly failed therapy. And where is their treatment plan? How long do they expect to tolerate a child treating you disrespectfully? And that goes on for months and years sometimes. Unfortunately, the next problem is that when the therapy fails, who gets blamed? The therapist won't accept responsibility. It's only her therapy or his therapy, but they weren't wrong. You were wrong. You didn't apologize. You didn't accept their feelings. You didn't acknowledge abuse that you didn't commit. So what happens then? You're sent for anger management therapy. You're asked to participate in education counseling. All the expectations fall on the alienated parent, not the child and not the alienator. So summary and conclusions. Parental alienation is a dysfunctional family dynamic that has a long history in jurisprudence and family therapy. 40% of the scientific research about alienation has been undertaken since 2016. These were all in the articles I presented. There's no dispute in the scientific community about its existence. Those who dispute its existence have yet to produce, this is important, a single scientific study that found that Gardner's 8 manifestations of an alienated child appear in severely physically abused children or non-alienated children of divorce. Not a single study. And those who dispute the validity of the alienating behaviors, they have yet to produce a single study that shows that separating and divorcing parents engage in these behaviors when they are not alienating. There's no alienation or the child hasn't rejected a parent. So severe and moderate cases require a subspecialist in alienation and estrangement. Severe cases are generally associated with complex psychiatric issues or severe psychopathology. PA is not difficult to diagnose if you know what to look for. Conventional therapy is virtually never effective. Highly specialized intervention is required. So these, I think, are some topics for future presentation. Elements of safe and effective therapy for moderate and severe PA cases that have been peer reviewed for safety and effectiveness. Greater discussion on the numerous counterintuitive issues in alienation, which confound most forensic evaluators and traditional therapists. I think this is very important. The fallibility of psychological tests when applied to an alienation case. There's a high false positive rate. They've never been validated for someone going through a custody evaluation despite their frequency, and certainly not an alienated parent. And they are supposed to be used for hypothesis generation only, not confirmation. So if you get targeted by the evaluator for a bad evaluation, you need to know that the limitations of these tests. We need greater discussion of the common cognitive and clinical errors that result in most erroneous findings, and an enhanced discussion of the 8 manifestations and the alienating behaviors. So I hope I'm invited back for more presentations.
So thank you, Linda, for your amazing presentation. And I'm certain that it has touched a bone with everybody on this call. So I'm going to go through the questions. And first, I would like to state to everybody, ISNAF will post this on our YouTube channel, not our website. Our website pretty much just has about the organization, but that's okay. We already have many other videos. Linda's on there, Dr. Miller's on there. And I also want to thank you for making a tribute to Dr. Miller. Like, what an amazing loss he was. And I hear you coming through him. And so thank you for.
Thank you. That means a lot to me.
So let me go through the questions. Let's see. Number one question is, do you ever see parental alienation presenting as oppositional defiant disorder in teenagers?
There are a whole host of comorbid symptoms that we see in these children. And obviously, I'm reluctant to give a child a label, but obviously, if the alienator is modeling antisocial behaviors, breaking court orders, making the child lie, that's oppositional defiant behaviors. So I'm reluctant to label it that, but I would say that what's happening is these behaviors have been modeled and normalized by the alienating parent.
Okay, thank you.
And the thing you should look at is, well, that's another thing that the profession fails to do when, I don't know how suddenly all these kids have become suicidal and cutting only after the breakdown of the marriage. That's the base rate. That's the prior for these children that is so important to look at. Steve, I hope you're listening to me. What were these children behaving like prior to the breakdown of the marriage? If they were functioning relatively normally, then you'd have to throw science out the window not to see that there's something happening after the parents separated where these children are suddenly developing all these extreme, bizarre symptoms that weren't present before. So you have to relate it to something happening in the family. And when you evaluate the alienating parents' behaviors, that's the causal connection to me.
Okay, thank you. So next question. This is a little bit wordy, so let me get through this. What are the prevailing theories that reunification therapists who do not adhere to parental alienation themes believe explains these situations in high conflict divorces? I.e., how are they thinking from their licensed, educated backgrounds?
They're not. And again, go to Steve's chapter, where what's the matter, sweetie? My new cat. They think they're just treating a problematical relationship. They're not, and this is a violation of the standards of clinical practice. We are required to look for the cause of a clinical situation whenever possible, because we're always supposed to focus on the cause if we can. And they don't do it. They're treating the symptom. The symptom's never going to change. It's like giving antibiotics to a person with an infection and returning that person to the germ-infested environment that had caused that infection to begin with. They're going to get reinfected. So I really, they listen to this poor child. I want to say this. Look, I do believe that probably 99% of my profession goes into this business because they want to help kids. They wouldn't be doing it if they didn't care about kids. But they get sucked in. These kids sound so credible. Why do they sound credible? Because they are being trained by an expert in manipulation. If these parents truly have a personality disorder, like the research shows for severe alienators, they are experts at mimicking normal behavior. As Steve said, They're the 4 C's. They're calm, cool, convincing, and he used another word for charismatic. I forgot what it was, but it's what charismatic is. So I'm okay. I used another C word. Oh, wow. Okay. But yes, so they get duped by these poor children who sound so credible that they're being abused by a parent. And they unfortunately don't scratch the surface. They don't ask follow-up questions, like, more details. And so that's why they make these mistakes.
Okay, so I'm going to move on. Thank you. So I'm going to move on to the next question, which I'm sure everybody would like to know if you have this resource, which I'm going to assert needs to be created. Psychology Today lists therapists by zip code all over the country. I have seen family therapy listed, but have never seen the subspecialty of PA. So I'm going to add the question to that. Where can parents get the list of those who are knowledgeable about PA and have been certified, if you know of a place?
Okay, well, we're not certified in PA, and we've talked about it. That was on Steve's to-do list, along with Amy Baker and a few other people. First of all, I would start with the PASG group. That has a wealth of people who have learned about this. You have to look at their CV. You have to look at their training. You have to ask them, well, first of all, if you go in and say, do you believe in alienation? And they say no, well, strike one. Well, that should be strike completely. It's unfortunate that so few people really do specialize in this, and it is a real big problem. I don't know what the solution is, but you can look at that list on PASG and call people in your state or locality, and maybe they could recommend somebody that they know. But it is a big problem.
Okay, thank you. So be aware. And the other challenge, not only in looking for your own therapist, is that oftentimes judges will assign a named therapist to your case, and then you're stuck with whatever you get. So beware. Next question is,
and can I just, that's why I said, if you're stuck with a therapist, you shouldn't just write off the therapist. Again, I gave you information tonight that you could use. Again, you need to get professional counseling as to how to use the information. You don't want to alienate the therapist, so to speak, but you need to, first of all, if I were an alienated parent, I would not be going into a therapist who you've researched and doesn't know anything about alienation and start throwing that word around. I would not use that at all. That'll get their back up. But I would start using other language like, maybe restrictive gatekeeping, or ask them, how often have you seen children reject a parent for what my child is doing? You may want to just ask questions. I would stay away from using the word alienation with the therapist, the forensic evaluator. They may get defensive about it, and that's not helpful. I would use other language on normal parenting. Half the times I'm tearing my hair out when I read these evaluations, and I say to myself, how does these professionals miss what's happening here? I could pull anyone off the street with a prudent parent's perception and ask them, would a child reject a parent for this behavior? I mean, they would know better. So, again, you can kind of be gentle and know your rights and ask for your treatment contract. What are my behavioral goals?
Okay.
How do we work on develop it together?
Excellent. Next question. Well, I'll come back to this other question, because this is sort of related to what you just presented or spoke about. I was always wondering how important you believe it is for the evaluator to have expertise in personality disorders.
They do need it because they don't know if they're going to be, because people with a personality disorders are experts at mimicking normal behavior. And yet on the witness stand under a good cross, they fall apart, absolutely fall apart. And I often say to myself, if a lawyer can make them fall apart, why can't someone with a mental health background trigger them? They just don't ask the follow-up questions. They just don't, I don't know, maybe they just don't think. I think they, again, they get fooled by their intuitive reasoning. They sound so credible. They run a trip around the evaluator, and it's very unfortunate.
Okay, next question, again, related to what we just heard about. What are the cost-effective ways to hire or find an expert to evaluate a situation when the reunification therapist isn't acknowledging PA, or simply reunification isn't working and the blame game is starting?
Well, again, I would stay away from those hot button words, and just, you might want to present the research study by Steve, Bill, and Amy about those 17,500 children, and just say, I don't understand something. Maybe you can explain it to me. These abused children sort attachment behaviors. Can you please tell me what I did to make my child hate me like this, or never want to see me again? Or have you ever, I would apply the Socratic method, not the didactic method. Meaning, I would ask the therapist or the forensic evaluator to ask questions that make them think. Do not tell them anything. They will take umbrage about that. Ask them questions to make them think about, if adjudicated foster children don't do this or reject a parent, why is my child rejecting me for something like this? How many other children did you see auto reject a parent? How often do you hear children saying, I never want to see my parent again, ever? How common is that? So I would ask questions that make the therapist think.
Okay. Linda, I am not familiar with that paper. Would you be able to send that to me, and then I can make that available to anybody who would like that?
Absolutely.
Thank you. I would appreciate it. Okay, so next question. I didn't see you mention the attachment related dimensions to this problem and role reversals. How important do you think that core competency is for an evaluator to have?
I'm not sure I understand that question.
I'm going to assert that it's probably identifying that how important is it for an evaluator to understand splitting?
And what I meant by it is using the child as a regulatory other for the parent's own emotional and psychological well-being. And
okay. I didn't have time to get into that, but that is one of their alienating behaviors, to make the child, it's what's called, it's part of the pathological enmeshment, and we call it parentification, where the parent makes the child feel responsible for them, their emotional health. When you go to your other parent, I'm so lonely, I don't know what I'll do with myself. Or, how could you go to that parent when he or she treated me so terribly? Anything that makes the child feel guilty, and responsible for that parent. Is that what you were asking about, Brett?
Kind of, yeah. I mean, it's related to the
Brent, not
yes,
Brett,
yeah,
Brent.
it's okay. It's related to the personality disorder part of it. As I understand it, as I've done research and learning about this, I have no mental health background. I'm just dealing with this. Is that oftentimes with narcissistic personality
Yeah.
disordered individuals, they can't regulate their own emotional
Mhm.
well-being. And in learning about that, it helped me learn what I had been through myself in that marriage. And but when the marriage ends, and now it's the parent with the child, now they need to replace that that regulatory other, or that basically the person that they rely on to modulate or mediate their own their inability to deal with their own emotions.
Well, like I say, the research shows that severe alienators likely suffer from one or more personality disorders, and I usually find that they suffer from all three. So narcissism is one of them, and
And narcissism and borderline are on a spectrum, are they not? So they're it's not that they're separate necessarily, they just present on a spectrum.
I don't know what you mean by that. On a spectrum, that's something very different than Asperger's syndrome. That I don't know what you're talking about when you say spectrum.
I meant borderline personality disorder and narcissistic personality disorder. Those two specifically.
They're a part of a group of just a personality disorder in general.
I see.
And there are lots of them. And someone with a personality disorder has, inner thinking and feeling and out of behaviors that are great variance with society. So, and I think antisocial is probably the worst. There's no way you can really help someone with an antisocial personality disorder. As a matter of fact, we have a saying in the field that how do you deal with an antisocial personality disorder therapist? Run the other way and save thyself.
Yikes.
Okay.
Yeah.
All right.
Well, thank you.
Thank you. And I'm going to just thank you, Brent. No, don't take this personal, but I'm going to have everyone else refrain from interacting personally because we have a lot more questions that I want to get through. But thank you for clarifying that. So the next question we have is, can we ask alienating parent to receive coaching and then require them to attend a session with the child where they verbally provide support and encouragement of the relationship with the targeted parent?
Well, that's a big if they get to that point. Obviously, that would be the goal. Like in any other case of child abuse, that the abusive offending parent relinquishes the behaviors, apologizes, and atones to both, by the way, to atones to the alienated parent as well as the child. There is a book that I'm starting to rely upon, which I cite when I justified the need, my request for a letter of the apology letter of the alienating parent in order to lift the no contact period. It's by Chloe Medonis, Sex, Love, and Violence. And she talks very much in there about when one family member harms the others, they have to atone, they have to apologize. So I say that I said now, okay, I've given the alienating parent now the 4 A's. They need to acknowledge, they need to atone for, they need to apologize for, and they need to abandon their alienating behaviors before they can be trusted, before they're safe to have contact with their children.
Okay, thank you. Next question. I have been told that you can't make a 16-year-old go to reunification if she does not want to. What can I do before she turns 18? I have 50-50 and it's all up to the child to seek or talk to me since age 11.
Very sad, and I feel sorry about that. You need a court order, unfortunately. And that's why the peer-reviewed programs for safety and effectiveness have a no contact order with the alienating parent. It's very sad. As long like the research showed in the Clower and Rivlin book, if the child is going to continue to have contact with the alienating parent, they're going to get reinfected.
Okay. Next question. And I've sent everybody in your link to please send questions that are no more than 2 to 3 sentences. So I'm going to have to skip one of our questions. Okay. Okay. Hold on. I'm just filtering through a few more questions here. Okay, listing PA on websites or marketing is a double-edged sword, as the alienating parent often rejects the court-ordered therapist right out of the gates. If PA training, awareness, belief, etc., is indicated anywhere, marketing, websites, reputation, etc., any thoughts on how therapists can get around this? And actually, that's an excellent question. We have that happening with a therapist in California who none of the alienating parents will agree to that therapist because she has a PA all over it, and she is actually a very renowned therapist in the state of California on PA.
Oh, gee. I've always had that expertise on my CV, and I don't think you can hide it legitimately anyway, because if you do, you will be accused of being deceptive. I think you have to put it right out there, and you have to make the case to the lawyer for the alienated parent that you have to make the case that this is child abuse and it requires a specialist. I know it's not easy, but I don't see being deceptive as the answer.
Okay. Any suggestions for adult children alienated since teen years?
Suggestions what to do to reconnect?
I'm going to assert yes. And one suggestion I have to this parent is might consider joining us for Karen Woodall's presentation, because she has a lot of expertise in that arena as well. And Linda, with that question, do you know of any programs that, other than, we know Josh Coleman specializes in adult children, but do you know of anybody working on adult children reunification out there?
No, I don't. I do think a support group is important. In general, I suggest staying in touch. At least once a month, holidays and birthdays. Don't forget your child. If you have any form, if you weren't blocked at all. But I think it is a good idea to get ideas from other parents who have been through this.
Okay, thank you. So we're a support group. Everybody's here. So you're welcome to continue in the work. Next question. Is there a prevalence of substance use disorder among alienators?
Substance abuse?
I'm going to guess it says use, but I'm going to guess the intention is substance abuse, or it says substance use disorder.
I don't know of any research that shows a connection either for the, well, not for the alienating parent, But I do know that Amy Baker has done some research that children who are victims of alienation have a much higher drug abuse rate than the general population. Yes.
Okay. So, yeah, well, I don't want to make that statement. I'll stay away from that. My alienated kid's father recently died. They are now adults. What chance is there that they will feel more free to respond to me?
Any crisis can produce change, and I certainly would try to step up the connection and attachment and see, I hope, another thing is that I think alienated parents need to be very clear about what they're going to say to their children if their children do respond to them. You can't be punitive. You can't say anything, negative about the other parent. You need to stay positive and just express that you're so glad that you've reconnected. But, I think that some may have the tendency or the desire to really express anger, and you shouldn't do that. So I think you may need some coaching as to what to say to your child if contact is restored.
Thank you. So for those people who are in that space, that's one of the things we talk about in our reunification strategies roundtable, which the one for tomorrow has already been filled. So check our calendar for joining into that group. Karen Woodall's programs, Learning Circle, she does talk about that a lot because the targeted parent needs to be in a certain space in order to be available for the child when the child comes back into your life, or to attract them back into your life. So ISNAF has multiple programs and presentations that will be in that arena. So we invite you to check our website and our calendars, and you'll get our announcements on that. So next question. It seems that alienators with these personality disorders are fixed in these. How does a therapist break through these and abandon them?
What, say that again?
It seems that alienators with these personality disorders are fixed in these.
What?
Are fixed in these, I'm going to insert these personality disorders, that they're stuck with them. So how does a therapist break through these and abandon them? Like, I believe the question is, and I'm just asserting this, is how do they overcome dealing with a personality disordered individual?
That's it, Cindy. How do you get them to change these behaviors?
Thank you.
Well, I avoid treating personality disorders because I like to be successful. It's very unfortunate. You do need very specialized skills. When I was talking about before, you need specialized, that's a specialty. That is a subspecialty within the mental health field. And it's not something I have specialized in. So, you need to find somebody who does.
Okay. Thank you. I'm going to just take a moment because a lot of these questions are in that arena. And there's a professional in California by the name of Dr. Julie Verner. I'm not sure if you're familiar with her.
No.
She was doing work. She's trained to do reunification therapy from Family Bridges. And she did a presentation, I'm going to say, probably about 18 months ago. And something she said that I thought was really profound for parents to understand is she no longer does reunification therapy for families. And this was why. And she said because the alienator will attempt to manipulate and manage her, and the child will refuse to communicate and trust her, and the targeted parent looks to her as being the saving grace. So she said, and quite often, if she can't have any success, if there aren't the 90-day protective orders there, that she cannot be successful in these cases. So she no longer will do those cases. She does the work through Family Bridges, but she no longer does her own work in that arena. So imagine who are we being? And then she still has the child with the personality disorder trying to manipulate her. And she discovered that it was very difficult and that there were quite often where in an arena where she could not have success based on all the dynamics, that then there would be all the complaints filed against her licensing. So just keep that in mind as we're working with these therapists, and as targeted parents, we're looking to them to be our saving grace. And what dynamics are they left to work with? Be mindful about that. So next question. In a case where the child aged out of court, do you suggest putting effort in getting the alienated parent to give the child permission to reestablish contact?
To give the alienated parent permission?
Do you suggest putting effort into getting the alienating parent to give the child permission, i.e. trying to establish a relationship with the alienating parent to support a relationship?
I mean, it's always an option. I don't think people should bang their head against a brick wall. I don't know why the parent would change just because the child aged out. I don't think that they have done anything significantly different. That's a motivating factor.
Okay. So, all right. So the next question here is, there a support group for alienated parents with adult children? ISNAF does run roundtables. If you're interested, just let me know and I will do another one for adult children. And that's working with 4 other parents focusing on adult children. Okay. We're getting to the end here, and then we're also running into our time. Okay, can you give information for the course in Europe? I live in Europe and have never heard of any post-grad courses in PA. That was Amanda. So Amanda Sillers runs an organization called Eeny Meeny Miny Mo. Deb, I'm going to suggest that you might write to her. She's in Australia for that information. There's a, okay. The slides from this presentation will be posted onto our YouTube channel, and we will make sure, given we did this appropriately, got it recorded right away, should be very little editing, so we should be able to get that out fairly quickly. And finally, let's see, we're going to go with multiple thank yous to you, Linda, multiple thank yous for Dr. Stephen Miller. And I can read them all, and I'll read this one. Ms. Gottlieb, thank you so much for your presentation. I deeply appreciate your passion, and thank you to ISNAF. So thank you. And for everybody to know, we've already prearranged with Linda. She will present again in November, and then we may actually add her for a couple of other presentations. Send me topics that you might like to hear in that arena. But I want to thank you all for joining ISNAF. Thank you, Linda, for your wonderful presentation. And thank you for being willing and able and available to be a student of Dr. Stephen Miller, because now we will carry forward his work in that arena. So Thank you again. So with that,
when I send you the presentation, it should be in PDF form.
Well, you know what? I wasn't planning to send that out. You can if you want, and then people who would like to have it can request it, and I'll send it out to them if you want, or we just get it off our YouTube channel, whatever's easy.
No, you could post it.
Okay. So go ahead and send me your PowerPoint, and those who would like to get the PowerPoint, please send me an email, and I would forward that to you. All right, based on your email that you send. So finally, with that, we thank you for joining us, Linda. We are so grateful to have you on our advisory board and all the work that you continue to do and your expertise. And we invite everybody to join the conference that PASG will be presenting in June. If you're not familiar with that, reach out and I will get you that information. And my final closing quote that I have based on this evening's presentation is by Mark and Angel. And that is, never regret being a good person to the wrong people. Your behavior says everything about you, and their behavior says enough about them. So with that, I hope you got lots of great information. Thank you for joining us, and we'll look forward to seeing you in our next presentation. Thank you again, Linda.
all. Thank you, and thank you for inviting me.
Well, it's
Thank you.
always our pleasure, and anytime. Good night, everyone.